Across the country, people of color are more likely to face mental health challenges and far less likely to get treatment for them. Why? In my own clinical experience, two barriers stand out: who's in the room providing care, and what it still means in many communities to ask for help. This is Dr. James McKnight, and I'm here with another Shrink Short. Today, we'll discuss the first barrier: people delivering care. Assertive Community Treatment teams, or ACT teams, are mobile groups of psychiatrists, nurse practitioners, social workers, and case managers who bring intensive mental health support directly to people in their communities. They're often a lifeline for people with serious mental illness. But look at who's actually on these teams, and a pattern emerges. Very few are people of color. The numbers tell the story. While African Americans make up roughly 14.4% of the US population, they represent only about 2% of practicing psychiatrists, 4% of psychologists, and 22% of social workers. More broadly, 37% of the US population belongs to groups historically underrepresented in medicine: African Americans, Hispanics, American Indians, and Alaska Native people. But only about 16% of the practicing physicians come from these groups. So, why does this gap exist? Part of the answer is what researchers call a leaky pipeline. Within psychiatry, underrepresented minorities make up about 16% of residents, but that drops to under 9% of faculty and just over 10% of practicing physicians. In other words, people of color enter training at higher rates than they end up staying in the field long term. Why does that pipeline leak? Researchers point to several compounding factors: unequal access to advanced training and mentorship early in education, financial pressures that make long, expensive medical or nursing training harder to pursue, and a workplace environment where providers of color often face isolation, bias, and a lack of senior mentors who share their background. Minority researchers and clinicians often experience diminished early access to training opportunities, stereotype threats, and decreased access to funding and mentorship barriers that build on each other at every stage of a career. Some institutions are trying to fix this at the source. Programs are building intentional recruitment pipelines, partnering with historically Black colleges and universities, and creating mentorship and affinity spaces to help providers of color not just enter the field, but stay in it. The results of all of this matters in very practical terms. When ACT teams and mental health care broadly lack racial and linguistic diversity, patients lose access to providers who understand their cultural context, may share their language, and are less likely to misread symptoms through a biased lens. In a field like psychiatry, which relies on the ability to accurately interpret behavior, emotion, communication patterns, and interpersonal dynamics, intimate connections to and knowledge of minority communities is especially important. This has been Dr. James McKnight with another Shrink Short. Tune in next time for a discussion of the second barrier to care access for people of color.